Hi, this is Dr. Arun Kannan, orthopedic surgeon. In this video, I will be talking to you about one of the most common orthopedic problems, backache. Almost everyone experiences back pain or backache at some point in their life. Backbone is a very strong bone and a very strong support structure. All of you would have heard backbone is very important. But the backbone is not a single bone, it is made of multiple bones and these are arranged in a specific pattern. In the neck, it is called the cervical bone. In the chest region, it is called the dorsal spine. In the lower portion or the lower back, it is called the lumbar spine. And these are not in a straight line. As you can see in this diagram, there are curves in this backbone. In the neck and the lower back, it is curved forwards, and in the chest region, it is curved a little bit backwards. So I want you to understand that it is not a single bone, it is made up of multiple bones, and these are arranged in a certain pattern of curves. And between these bones, there is something called a disc, which is like a cushion between the bones. Many of the problems of the back arise from problems in the disc or the cushion between the bones. That is why I think it is essential to have a little bit of understanding about what the back is, what the backbones are before we attempt to correct it. A lot of you would have heard of disc problems, sciatica, spondylosis. All of these are related somewhere to the disc problems. The disc can be damaged in two different ways. One is when you do a sudden activity like lifting weight in a forward bending position and the disc gets strained. The second way, the more common way the disc gets damaged is from prolonged stress. This happens because of incorrect posture most of the time. So the most important method to prevent back pain or disc problem is by maintaining a proper posture. Most of us sit for long hours. We have 24 hours in a day and most of us end up spending at least 10 to 12 hours sitting. We spend about 8 hours sleeping, rest of the 2 to 4 hours standing or walking. So sitting posture is the most important thing that we have to control. If you sit in abnormal postures for long periods of time, the disc gets damaged. The unfortunate thing is that once the disc is damaged, it cannot be repaired back to the entire original position. So prevention is very much worth its weight in this situation. So in this picture, I have shown you three different ways in which people commonly sit. Two of them are wrong and only one of them is right. So a common mistake that people do when sitting is they are sitting and bending forward when they are doing their work, especially at a desk and something else. So this again puts a lot of strain on the back over long periods of time. Second, more common way people think they are sitting in a relaxed position is they come forward in a chair and rest in a slanting position without the back being entirely supported. This again is a wrong way of sitting and places tremendous strain on the back. Only the lady on the left is sitting in the correct posture and we will look at what all she is doing right. The chair should be supporting the entire back up to the shoulder blades. And whenever you sit in a chair, you must go all the way back. The buttocks should rest against the back of the chair. The knee should be at the same level as the chair or slightly higher so that the back gets full rest. The feet should be resting well on the ground or on a small footstool. Also, you can note that there is a small gap between the back of the knee and the front of the chair. This is again very important. If there is no space, people tend to sort of slide a little bit forward to create this gap and again strain the back. So sitting properly is the most important way to avoid back pain, and this is because we are used to sitting long periods of time in our daily jobs these days. The second thing is to lie down properly. As I said, we lie down most of us about 8 hours or 7 hours a day. And lying posture is very important. The best position for the back is to lie supine or on the back. Use a mattress which is not too soft or too hard. A lot of us think if we have back problems, we should lie on a hard surface. This is not correct. As I explained earlier, the back is not straight but is made up of curves. So a hard straight floor is not very conducive to the back, and this is why we recommend a bed that is not too soft or too hard. It must be reasonably firm to support the back. At the same time, it must give way to the curves in the back. Sleeping on the side is okay for some time, but not the best position. Lying on the stomach or face down is not good for the back at all. So proper sleeping posture again is very important because it occupies about 7 to 8 hours a day. The third way that people commonly damage their back or the disc is when lifting weights. So we must know what lifts we can lift and how to do it. If you bend forward as it is shown in this diagram and suddenly lift a weight, it puts a lot of strain on the back. Instead, if you bend your knees and hips, go down, keep the weight close to your body and lift it up, it evenly distributes the weight across the back, hips and the knees. So in summary, the back is a strong structure made up of multiple bones that give it a very curved shape, and between these bones there is something called a disc, which is like a cushion between these bones. The disc must be protected by proper sitting posture, by proper lying posture, as well as maintaining precautions when we are lifting weights. Here I have shown some exercises that are commonly prescribed for back pain as well as for maintaining the strength of the back muscles. These exercises are best done under the supervision of a physiotherapist. We can learn these exercises from a therapist and do them on a regular basis to avoid back pain.